Buongiorno, everyone. Welcome to today's Beyond the Sea webinar, Health Literacy in an Academic Environment. My name is Jared Irwin, the Consumer Health Coordinator for the Southeastern Atlantic region. Before we begin with today's guest presentation, there are a few administrative details I'm going to go over with you. As you are sharing, communicating, or asking questions in the chat box, all of which is encouraged, please be sure to select all attendees from the drop-down menu so that I, our guest presenter, and your colleagues can all see your questions and any information that you share. During the session, there will be designated times where our presenter will pause for questions and comments, and there will also be time at the end to ask our speaker any remaining questions. If you need closed captioning for today's webinar, I will post that link in the chat box. Right. Okay, I see it is still right there at the top. Great. So it is that URL will take you to a live captioner if that is necessary or helpful for you. So today, our guest presenter is Semhar Yohannes. Semhar has been serving as a science reference and instruction librarian for nearly a decade. Following her graduation from the LIS program at the University of Maryland, College Park, she worked as the science librarian at Capital Technology University, developing their information literacy program. In her current role at the University of Maryland, Baltimore County, she teaches library instruction sessions, conducts reference consultations, and has developed workshops and other outreach initiatives with a strong focus on health literacy. In 2018, she obtained her Master of Public Health degree with a concentration on health literacy in young adults. Everyone, please welcome Semhar.
Hi, everyone. So just give us one moment as we transfer ownership of the screen. Okay, great. So welcome, everyone. And before I start, I just want to make just do a quick sound quality check. Can everyone hear me okay? If you can or cannot, can you let me know in the chat box? Okay, it's looking that everyone can hear me. Excellent, excellent. Okay. So I'm Semhar Yohannes, and I am the Science Reference and Instruction Librarian at the University of Maryland, Baltimore County. As Gerard said, I've been at UMBC for nearly a little over 6 years, and I've been a librarian for nearly 10 years. To give you some background, some context about my university, UMBC is a mid-sized university located right outside of Baltimore and around 40 minutes from downtown DC. We have 11,000 undergraduate students and around 25,000 graduate students. 2,500 graduate students. The majority of our students are commuters. We are a STEM school. We are a school that very much supports and advocates our undergraduate and our graduate students doing research. Currently, we are on spring break, but after spring break, our classes and our services will move online because of the pandemic. We do not know when we're going back to campus, if we're even going back to campus this semester. It's a bit of a state of chaos and confusion right now, and something tells me that a lot of the people that are listening right now, they can understand. You guys can understand. So originally, about maybe until 4 days ago, I was going to start this webinar with a survey asking you guys, where do you think young adults obtain their health-related information? And then I was going to segue into, sorry, I just got slightly distracted by one of the chat questions about phone call. Okay, anyway. So anyway, I was going to segue into mentioning who searches online for health information. And it turns out it's overwhelmingly the younger that you are and the more educated that you are, that you're going to search online for your health-related information. But 4 days ago, I received a text from a family member, and that family member said that they knew the way to prevent the coronavirus. If I consume boiled garlic, that I would be saved from getting this particular virus. And when I read that particular text, the internal voice in my head said, oh God, even in my own family. So even in my own family, the importance of health literacy was very clearly demonstrated. If you go to the World Health Organization, they have a whole webpage just dedicated to dispelling the myths associated with this particular virus. So no, the cold weather won't prevent it, snow won't prevent it, heat won't prevent it, UV lamps won't prevent it, and on and on. So between the text from the family member and reading and seeing all of these myths around this particular virus, it just hammered home again for me the importance of health literacy. Plain and simple, health literacy saves lives, it saves you money, and it prevents a lot of unnecessary stress and anxiety. The agenda for this webinar will be that I'll go over background, targeted research, and then end with content creation. I'll stop ever so often to take your questions. I've always found that to be a lot easier for me to answer questions sort of throughout the like a webinar session than wait to the very end. To ensure that we're all on the same page, I'll go over health information, background content, the cost, the consequences, and then health literacy with a particular focus on young adults. So when I've asked this question, what is health literacy? I've always gotten a myriad of responses. People understand what health means, people understand what literacy means, but when you combine those two questions, I tend to get a lot of blank stares from the students that I'm working with. When those two words are together, it's as if their brain sort of shuts down. According to the Affordable Care Act, health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. Health literacy refers to the skills necessary for individuals to participate in the healthcare system and maintain good health. These skills include reading and writing, calculating numbers, communicating with your healthcare professionals, and using health technology. I know that when I first read this definition a number of years ago, it felt really familiar to me. This is very similar to the work that we do as librarians, but just with slightly different content. The importance, it's important to know that when people are talking about health literacy, that you are aware that there are different levels of health literacy. The National Assessment of Adult Literacy provides information on health literacy levels, and this organization has defined 4 different levels of health literacy. There's below basic, basic, intermediate, and proficient. The term basic is often interchanged with the term low. So basic facts to know about health literacy and the U.S. population. Nearly 9 out of 10 U.S. adults have difficulty using everyday health information. Nearly 9 out of 10 U.S. adults cannot calculate an employee's share of health insurance costs. The average annual health costs of those with low health literacy are 4 times greater than those that have intermediate or proficient health literacy levels. Low health literacy costs the U.S. healthcare system somewhere between $30 to $73 billion annually. Health literacy is a better indicator of one's health status than age, income, employment, ethnicity, or education level. The overall theme of this slide is that it is extremely expensive to have low health literacy. In this image that you see on the slide, it's from CDC, and they state really clearly having low health literacy results in greater use of ER, longer hospital stays, poor patient compliance, and higher mortality rate. So not only is it expensive to have low health literacy, it's also fatal. In the previous slide, I talked about how low health literacy is problematic in terms of your health and in your pocketbook. But if you flip that around, having improved health literacy is beneficial for a number of reasons. Those reasons can be reduced to 4 main points: enhanced quality of care, improved community health, reduced health costs, and improved patient and provider experience. These 4 sort of points, or reduced 4 benefits for having improved health literacy, are referred to as quadruple aim. Overall, it's beneficial to yourself, to your community, to have a higher level of health literacy. It improves your health, it improves the health of your community, and it saves you money. On a more positive note, many studies have shown that college students have adequate levels of health literacy, but the term adequate is vague, and how does that really fit within the 4 levels of health literacy levels that we just talked about a moment ago? There's actually very little information available regarding college students' health literacy levels, but we do know a couple of things. We know that college students spend a significant amount of time in stressful environments. We know that they're more likely to engage in unhealthy behaviors. Having higher levels of health literacy can help college students make more appropriate decisions about their health. So the image that you see on your slide is the front page of a book called Investing in the Health and Well-Being of Young Adults. If you are just starting off in your health literacy initiative at your library, you're not really sure where to start, I strongly recommend this book. I think I read it maybe 4 or 5 years ago, and I found it really helpful just to sort of give me a sense of like my student population, young adults in general. I want to be sure that I distinguish between health information and health advice. The focus of my work is to support the health information needs of the students that I work with or the patrons that I work with. The information could assist them in answering questions for a paper, or understanding a health topic, or empowering them to make an informed decision about their health. I am not here, but more importantly, I am not able to tell them which primary doctor to select. I cannot tell them whether a symptom they have is worth going to the doctor for. I cannot give them advice. My work is strictly in the arena of health information and not advice. It's really important that we distinguish this boundary, that we assert this boundary really clearly, because it can get really dicey if we don't. I know that I've been pushed by patrons that I've worked with, especially the ones, surprisingly, that I've developed good trusting relationships with. They assume because I had several years of working with them, they know me, they know a little bit about my background, I know about them and sort of their interests, that somehow that means that I am qualified to give them advice when I'm not. I can only give them health information, not health advice. And like I said, it's been slightly at times challenging asserting this boundary, but it's important that we do assert that boundary because, like I said, it can be dicey if we don't. So some good housekeeping. Accidents can and do happen, and you'll need to protect yourself and your library. The Let's Move Library.org website has a liability form for public libraries, but you can easily customize it for your academic library. Just as a side note, they have a different liability form for different activities. So if you're doing a walking activity, a bicycling, a yoga activity, they have a liability form for you. But so they have this, but in addition to this, I would also recommend that if you're going to do an activity that requires a liability form, that you talk to your campus health service office to see if they have a liability form. For the programming and the content that I've done so far in my library, I have not needed to use a liability form, but it's nice to know that if I need one, that it's there. Okay. So I'm just going to stop and see, do you guys have any questions before we move on to talk about more targeted research and content creation? So if you do have a question, just put it, or like, just add it to the chat box. Okay, there's one there. No, I really appreciate your description of health. Oh, thank you. Yes, the slides will be available. So I just wanted to take a moment and go back to the slide about advice and information. As I said before, what surprised me was that I was getting pushback from people that I knew, students that I had an interaction with, or members of the general public. So UMBC is a state school, so we're open to the general public, and there's a number of members of the community that come and utilize our library, and I know them and I've seen them a lot. And because you are a trustworthy person in their eyes, because they've seen you, they've worked with you before on personal matters or maybe a research topic, they feel as if somehow that relationship has maybe moved past the realm of someone seeking input on a professional matter to something personal. And like I said, so I've always been surprised of those who push me on that boundary. Okay, let's see, another question. Did you think the health literacy assessment, I'm curious about, did you link to the health literacy assessment research? I'm not sure what you mean by this question. Did you link to the health literacy assessment research? Can you give me more information, please? You said there was an assessment survey. I believe some of your results were reporting. Yeah. So everything that I talked about, I'm going to talk about throughout the session, you'll find in the notes section for under each slide. So if I'm referring to a study, if I'm referring to an assessment, if I'm referring to the national, let me go back. I want to say the acronym correctly. It's the National Adult Assessment. Yes. So when the slides come to you, if you go to that particular slide and go to the notes section, you'll see a link to it. Excellent. Okay, great. So I think we're ready to move on to the next portion. So from understanding what health literacy is and the costs and consequences, let's sort of segue into talking specifically about our target audience and target researching. To give you some context about the health literacy initiative in my library, I'll give you a very, very brief sort of review of the last 3 years of my professional life. So halfway through my MPH program, I had to start thinking about what I wanted to do for my capstone and where I wanted to intern. I knew that my preferred audience and my preferred setting were college students and higher education. So for my capstone and for my internship, I settled on focusing on the health literacy in young adults, and it fit well with my background because I'm a librarian. And so while this was going on, my library was going through a strategic plan, and one of the goals that was eventually developed was basically the library would meet the information needs of our students and other members of the UMBC community, and that's it. It didn't specify what type of information need that we were going to provide. And so with that open-ended sort of goal, I decided to take what I was learning in my MPH program and apply it to my library by developing a health literacy initiative. I knew that I had to keep my goals fairly open and vague simply because I didn't know what the end goal would be. And so my goals for phase 1 were provide opportunities for students to improve their health literacy and establish cooperative partnerships. I knew that the goals that were useful or were going to be useful for phase 1 of this sort of health and literacy initiative weren't necessarily going to be the same goals during maybe phase 2 or phase 3 of this project. But for phase 1, these two fairly open-ended general goals met my needs. So step 1, develop the goals. So I did that. Step 2 was research. So I researched on health literacy of young adults, preferably in academic libraries, and this is what I found. There is lots and lots of research on the health literacy of young adults. There's slightly less research on the health literacy of young adults, or excuse me, there's slightly less research on the health literacy initiative of libraries. Of the libraries that were focused, it would be overwhelmingly on public and medical. And there weren't, surprisingly, a lot of research on the health literacy initiatives in academic libraries targeting college students. The majority of the content that I found talked overwhelmingly on about public and medical, which is great for those two sort of types of librarianships, but wasn't really helpful for me. Library literature talked a lot about how faculty, students, and staff think of the library as a place for them to find resources or address their information needs for their academic, for their research, or even for their professional needs, but they didn't consider us for their health information needs. This strange blind spot that students had in terms of not considering us for their health information needs really contradicts the intent of this image that you see on the slide. How can we be partners if students forget about us when they're addressing their health information needs? The literature highlighted that students don't utilize the library when they're trying to address their health information needs, which then really speaks to this massive gap that we're not addressing with our population. So after looking at the literature, I thought, well, let me try with the video content. Maybe I'll have better use or better luck with videos or uploaded content. And this is some of what I found. I also want to take a moment and thank a particular librarian over at NNLM who was one of the people who helped assemble some of this content, Liz Waltman. But this is what I found. And you'll note, not a lot of it towards academic librarianship. So the same problem that I was having with the literature, I end up having the same problem with the video and webinar content, not information targeting academic libraries, looking at college students, students within higher education. As a side note, if anyone, again, is just starting off with their health literacy initiative in their library, I strongly recommend the webinar that says Health Literacy Begins at Your Library. This is a webinar that's geared towards public, but it still has a lot of useful content, and I found it to be useful. So not finding direction or targeted useful content from the literature, from the uploaded videos, I thought, well, let me seek guidance from professional organizations or library organizations. Maybe they have content that I'm not finding, or maybe they're a little bit further ahead than some of the other places that I was searching. And so I'll briefly go over some of the musical organizations and what they're doing in terms of health literacy. So Public Library Association recently launched a new website compiling training resources and programming ideas, but it's for public, overwhelmingly useful for public. Medical Library Association recently published a book that covers the basics in health literacy, focusing on public and hospital libraries. CDC has a list of educational and community health literacy activities for libraries, but it's mostly for public. And then LM has a lot of webinars and reading content. RUSA has a health and medical reference guideline. The Health Happens in Library is a program that highlights what public libraries are doing in terms of community health, and so on and so on. The same problem that I found with the literature, that I found with the webinar and video content, I found with the professional organization and other library organizations. There just wasn't a lot of information about the health literacy initiatives in academic libraries targeting young adults. So after reviewing the literature, reviewing the videos, looking at the various professional organizations or just library organizations in general, it became pretty evident that I needed to do more primary research, that I wasn't going to find a lot of guidance from the more traditional paths. So as I said, it became apparent that I needed to do more primary research that was tailored toward my very specific audience, UMBC students. As the science librarian, I know my STEM students. I know what their research interests are. I know what resources they like. I know what classes they struggle in. I know what departments are research heavy. I know academically the STEM students. What I did not know at the very beginning of this particular project, I did not know necessarily UMBC students as a whole, let alone their health information needs or their health literacy level. As I stated at the top, I needed to do more primary research in order to better understand their health issues, their health concerns, and their health information needs. So I needed to develop a snapshot of the young adults in my state. And once I had a snapshot of the sort of young adults of my state, I could then better maybe develop a understanding of the students on my campus or eventually work my way there. So I'll briefly go through some of the links here and what I found and where I went to look for information. So I looked at the Maryland Vital Statistics and Reports page and focused on 3 counties. And the reason why I focused on those 3 counties were that those were the counties that UMBC overwhelmingly gets its students from. And so I looked at what's called health status, mental health, quality of life, etc. I then looked at the state health facts of Maryland and again looked at 3 counties because those are the 3 counties that UMBC gets its students from, or I should say mostly gets its students from. And I looked at the sections of like health status, mental health, physical activity, STI, etc. I looked at the county health rankings and roadmap, again, focusing on those 3 counties. And I looked at only 3 sections here: quality of life, healthy behaviors, and physical environment. UMBC is a racially and ethnically diverse, has a racially and ethnically diverse student population. So I spent a lot of time looking at minority health and minority health network. For some of those, for some of these, I should say, for one of these resources, they didn't necessarily specify by like counties, but they did it by state, and for others, they did it by county. And so I wasn't consistent with what kind of information I was able to pull out in each of these resources, but it was enough that I could build a picture. I also looked at the, healthpeople.gov, and I specifically looked at their adolescent health section. And I also looked at the Youth Risk Behavior Surveillance System database. This particular database monitors 6 different categories, such categories as like unhealthy dietary behavior, tobacco use, sexual behavior, and it's called sexual behaviors related to unattended pregnancies and STI. The whole purpose of this was just so I can get like a snapshot of the young adults, the people in my county or counties or in the state. I also reviewed available data that UMBC provided. UMBC is a state school, and because it's a state school, the state of Maryland commissioned something called the Maryland Higher Education Commission Report, and within that, there's UMBC information, and so there's information about like what educational status our students are when they come to us, what's their SAT scores, what's their enrollment rate, etc. So I looked through that particular document and sort of just focused on the UMBC portion of it. I also looked at the available data that UMBC provided on its website. So UMBC has a fact sheet, and so I looked at that. In addition to the fact sheet, it has a number of links to additional documents, so documents that talked about like student retention, department size, graduation rate. I am the faculty senator for my library, and I represent my library on Faculty Senate, and so because of that, I get access to maybe a little bit more documents than other people have access to, and sort of I took advantage of that in order to get a better sense of who our students were in order to help me with this project. I also contacted the health promotion, or excuse me, the director of health promotion at my university health services and asked her, what do our students come to you guys for? What are their most frequent problems or concerns? Like, why do they utilize your service so often, if they do? And she said it fell under 2 big categories: mental health illnesses, and then STI or STD checking. So our students come in for a lot of STI checking, which is great, you know, good to be healthy. So the whole point, the whole end goal is that to better understand the health status and the health information needs of our students. So So just to review, in order to better understand the health status and hopefully the health information needs of our students, I went and looked at government data, looked at state data, looked at available UMBC data, and then contacted the University Health Services to learn why our students are utilizing their services. So I'll stop and see, does anybody have any questions so far about targeted research before I move on to the last portion? So one of the questions that came up is what 3 areas you focus on. I don't know if I focused on necessarily 3 areas, but I knew that I was interested in sort of checking on like alcohol abuse. I was interested in STI, STD checking. I was interested in tobacco use or other sort of like extra like drug use. But they weren't necessarily things that they weren't only 3 areas that I focused on. I will say this, prior to this, prior to speaking to the health promotion director at my University Health Services, I would not have thought that the 2 main areas that our students seek them out would have been mental health and STI checking. So I learned something new. You mentioned quality of life and 2 others. Yes, so let me go back and show exactly where they were. So it was quality of life, healthy behaviors, and physical environment. And so, like I said, UMBC is right outside of Baltimore, and we get a lot of our students from Baltimore County. Baltimore County has a lot of physical environment elements, and I wanted to better understand the state or the status of that from the students that we got. So I'll just sort of mention some of the criteria from the various databases that I looked at. I looked at, for some of them, health status, mental health, physical activity, STI, quality of life, health behaviors, physical environment, let's see what else, unhealthy dietary behavior, tobacco use, alcohol, and other drug use. So one thing I was surprised that didn't show up when I talked to the health promotion director was that Maryland has a fairly high number of, or high percentage of students that are food insecure. And we also have a number of students that are homeless on campus. And I thought that would show up in some of the data. And so, in some sense, it does show up in the mental health, but I thought that it would also show up in other ways, and it didn't. I think, okay, that's it for questions. So let me move on to the next section of this webinar. So once I developed a snapshot of the UMBC students on my campus and got a sense of their health status, I could better develop content for them. I knew pretty immediately that I didn't want to do this alone for kind of 2 big reasons. One, burnout. This isn't part of my normal job. This is something that I've chosen to take on, so I was always really careful, and I'm really mindful about not wanting to burn out. And also, I knew that the work, the end product, would be better with more collaboration and better partnership, or more partnership, simply because expertise and different perspectives. At the start of this, and even now, I'm the only person in my library that's interested in health literacy. The head of my department is really supportive of this, encourages me to sort of continue with this project, encourages me in terms of like professional development, pursuing this. But, nevertheless, I'm still the only person in my library that's, thinking of ideas, co-hosting events, creating content, etc. So as I said before, I'm really keen on developing partnerships so I don't burn out, and also that the end product is better for the students that this is all for. So I just want to do a quick little exercise. I just would like you all, if you're with somebody or if you're on your own, take a minute or so to think of possible partners if you were developing your own health literacy initiative in your library. Who would you partner up with and other sort of people on your campus? And once you've sort of discussed it or thought about it, take a moment and just mention that or write that within the chat box. So I see somebody wrote college activity or faculty, nursing college, student organizations. Someone wrote 2 of my immediate coworkers. I have to say I'm a little jealous. I see someone else wrote student health service, health promotion, counseling center, Native Services, Alaska. Let's see what else. A lot of counseling center, student government. That's a good one. Public health. Yep, that's another really good one. Oh, someone wrote they're on the health literacy research team, which is health faculty and students. Nice. Okay, I think we have a pretty good list generated. I see a lot of similarities. So a lot of people are mentioning student government, faculty and staff, their campus health services, counseling center, etc. Okay. So this was the original list that I generated with my head of my department. And this list has subsequently grown now that I'm on sort of phase 2 of this project. But for phase 1, this is what was generated. So the very first 2 listed on the left-hand side where it says Health Administration Policy Program and Environmental Safety and Health. Those are 2 academic departments that I work with. I already have an existing relationship with. I know the chairs. I know a lot of faculty. So that was an easy one for me to sort of think about, oh, great partners to work with. The next one is the University Health Service. As I mentioned before, the on-campus health service I already have an existing relationship with. The 4th one listed on that same column is Counseling Center, fairly traditional partners for libraries. I haven't personally worked with them, but I know that a number of other committees and task groups within my library have worked with them. So that was one I knew that if I was going to try a partnership with them, it would be fairly, there was already established ground, I'll say that. It goes without saying that you have to be really mindful about when you select partners or you bring people onto a project, because selecting the wrong partner, selecting the wrong organization to work with can kill partnership, can increase a lot of sort of add stress, anxiety, or it can just kill a project altogether. So for phase 1 of this project, I chose to contact the University Health Service because I already had an existing relationship with the Director of Health Promotion. We sort of, I think we worked on a committee, a campus-wide committee before, so I knew her, I knew what her work style was, and I'd sort of, spoken a little casually with her, so I thought maybe she would be a safe bet to start with. I contacted her. I kind of expressed these were the goals that I want to accomplish. This is what I would like to see as an end product. But I'm really open to hearing what you have to say. And, are you interested in working with me on this project? Are you interested in maybe including other members of your department in this project, I'm open. And she said yes, so that worked out well. So for phase 1 of this project, this is what we've created, and I would say it's more of like 2.5 than necessarily 3 different items. And I'll go through each of the sort of 3 items. So the first thing that we started with was digital signage. It's straightforward, it's fairly like low-hanging fruit, easy to accomplish. As I mentioned during the targeted research, one thing that I learned during my research portion of this project was that UMBC students utilize the library or utilize the University Health Services a lot for STI testing. So the first batch of digital signage was about that. So STI testing, mobile clinic, one-on-one and STI, etc. The content that was created was a mixture of static and animated final product, I should say. I contacted the Digital Signage Library Committee about posting this within all of our digital signage. They said yes. I never got, and nor have I ever gotten any pushback about any of the digital signage that I've asked them to post. We have a number of monitors all throughout the library. The most prominent one is when you first walk into the library, right above, right when you walk into the library, there's this massive digital sign, and students always stop and look at it because it's massive. It has a lot of colorful content. It has content about our workshops. It has, digital content about STI, but it also has information about how many computers are available per floor. So that always gets a lot of traffic. So that was the first big thing that we did. The second big thing that we did was we created a workshop, and it was between the director of health promotion and I. We co-hosted it. And there's 2 versions of this workshop. There's a 30-minute version, and then there's a 15-minute version. The 15-minute version of this workshop is taught once a semester, so once in the fall and once in the spring. It's given during some sort of there's a health-focused week that occurs every semester, and it's run by University Health Services. I don't have anything to do with it, but this particular workshop is one of the events that occur during that health promotion week. This workshop is given in the gallery of the library. The library has a massive gallery on the first floor. That's where this event is hosted. Then there's the 30-minute version of this workshop. But during the 30-minute workshop, it's a condensed version of the 15-minute, and this is one of the workshops that UHS, so University Health Services, offers various organizations on campus, one of them being Res Live. So occasionally I can do it, she can do it, or if time works out, we can both do it. But for that one, we both don't need to be there. So those are that's the workshop. If anybody has questions during the Q&A, I can sort of tell you more about how we run those workshops. We begin each of those workshops with a health scenario, etc. But we're a bit short on time, so I just want to make sure I get through all of the slides. And the last thing, the strategic plan. So this is less content creation and more environment creation. As I mentioned before, when this initiative was starting off, my library was going through a strategic plan which lasted about 2 years. There were a lot of opportunities for input and listening sessions. I lobbied super hard that one of the goals that we would have, or that was listed within the strategic plan, indicated that we were here to meet the information needs of our population, that it would not specify what that information need. It would not say that it was academic, it would not say that it was research, it would simply just say that it was information need. UMBC is a state school, so we serve the UMBC population, and we also serve members of the general community. As the library literature indicated, students don't see the library as a resource for their health information needs. One way to addressing that gap that we don't serve is for us to not limit the kind of information needs that we serve by indicating in the strategic plan that we're only here to meet a certain type of need. So I'm currently within phase 2 of this project, and I have to say there's been a significant lag between phase 1 and phase 2, simply because of my normal work life just became very busy. So during phase 2, as I mentioned before, I knew that the goals that I had for phase 1 were intentionally vague and open-ended because I didn't know what the end goal or end product would be. But now that I have a better sense of what what kind of direction I want this project to go, phase 2 goals are different and a little bit more narrow. So the 3 goals that are for phase 2 are increase students' ability to identify reliable health information, strengthen students' understanding of their health-related resources, and increase stakeholders' engagement in developing communication strategies. So some of the projects that are occurring right now during phase 2. Working with new partners, so there's been additional partners that have been identified and added to that list that I showed you earlier of all the sort of partners that were thought of, or other campus partners. But so the new partners, or the partners that I'm outreaching right now to, are my 2 academic departments. It's the Health Administration Policy and then the Emergency Health Services. Those are 2 academic departments. I have an existing relationship with them. The reason why I'm working with them during phase 2 and not some of the other partners that I selected was that I have an existing relationship with them, but more importantly, they already have like a lot of existing content. And so they really do short little sessions on, for instance, like CPR. They really do sessions on mental health and food insecurity and other such things. And as I said before, I'm the only person in my library doing this, so I have to be really mindful about how who I select in partners, because I'm a lot of the time I don't have the time or the energy to kind of create new content on my own. So if I can co-host, if I can sponsor, if I can bring people who are already doing things on campus over to the library and have them utilize our service to advocate health literacy, I'm going to do that. The next thing that I'm working on is the online toolkit. So this was originally something I wanted to do during phase 1, but was unable to do it because we lost our web librarian. We only just recently hired a new web librarian, and this person just started a month and a half ago. So I don't want to necessarily bombard this person with like, here's this new project I want you to do for me as soon as possible. But this is something that's on my plate now. The link that I have is to Connecticut State Library. They have a really good online toolkit. I kind of sketch out what I want, but I've used this as a model. I also have something called, I have something up listed here called graphic medicine. The NNLM has a graphic medicine traveling exhibit. It's around like 50 different collections. The collections all like health related. The collections are fun, they're creative, they're eye-catching. As I said before, my library has a gallery on the first floor. It's massive, it's beautiful. We have lots of exhibitions. We bring a lot of traveling art to that particular space. I've already spoken to the gallery exhibitor. She and I went through the graphic medicine website and looked at the different collections. She really likes it. She supports the idea. The only drawback is that the gallery calendar is booked for the next 2 years. So when this occurs, won't be for at least 2 years down the road. And the last thing that I'm kind of pursuing right now is looking more into grants and research. There's a lot of grants focusing on like health literacy, health communication, health education. It's a really sort of interesting and new experience for me, because I've never written a grant before. I've never sort of participated officially in research. Okay, so this is just some of the grants that I found online that are focusing on like health literacy, health education, health communication. Like I said, this is something new for me. If someone is interested in pursuing this, I would recommend that many of these grants that I have listed and other grants that you'll find online, they have a lot of listserv that you can register or like put your contact information, and so you'll get constant updates if there's any changes, deadlines, that sort of thing. There's also a lot of ongoing research in the realm of health communication, health literacy, and this is something that I want to pursue. I've done a number of professional development just on the phase 1 of this project, and I've been really, really surprised at how enthusiastic the communities that I've gone to, and they're not library communities. I've gone to a lot of professional development that are geared towards like health communication or healthcare technology and communication, and the response has been really positive. And so if you are on the fence about pursuing this, it's been really enjoyable, and there's a lot of interest within surprisingly different venues. So lessons. Don't do this alone. As I said, I am the only person in my library doing this, so it's really important that I seek out partnership. Different partnerships bring different experience, different expertise, and I really enjoy sort of working with different people, kind of learning from them. Burnout is real. Working with other people is one way to avoid it. What works for UMBC may not work for you, and so it is really time-consuming to do the targeted research, to learn about the students of your state, to learn about the health concerns or health information needs, but it's necessary in order to create content that works for your audience. A number of big schools have Department of Public Health, and within those Department of Public Health, they have a health literacy unit. So for me, the big school in my state is the University of Maryland College Park, and that's where I obtained my MPH. And within that particular department, they have a health literacy unit, and that particular health literacy unit is constantly churning out content, conference opportunities, reading material, and I've just found it really useful just to always keep up to date on what's going on within the health literacy world, not necessarily health literacy world of libraries, but just in general the health literacy world. And if you're interested in pursuing grants or participating in research, make sure that you do a lot of good record keeping. So keep up to date with your statistics, the number of people who attend, the number of programs, who you're working with, if you're co-sponsoring, co-hosting, etc. So I'll keep this pretty brief. For final thoughts, I'm going to stress the importance of tailoring your content to your audience. What works for UMBC students may not work for your students, so you need to put in the effort in learning about the students of your particular state and then your particular school. Don't underestimate how much time it takes to research. It ate up a lot of my time going through the government and the state databases, going through those organizational websites, trying to learn about the people of my state and the students of my state and then of my school. And then the final thought is that one thing that I learned during this project is that, and also I was really surprised to learn this, the largest single personal consumer information need that US has or Americans have is health information. And we see that right now during the coronavirus. Right now, academic libraries are not part of this conversation. We need to be, and maybe a health literacy initiative is just one way for us to start getting ourselves in that conversation. So that's it for me. I'm going to turn it over to you guys and see if you all have any questions for me. And we have maybe about like 8 minutes left. What resources would you recommend for combating disinformation as opposed to providing information? So when I've done the digital, for the digital signage and for the workshop, I've been really clear in selecting or citing organizations that are big and prominent, if not national, global. So I've been always citing WHO, I've been citing CDC, I've been citing NIH. I think there's less likely for people to push you on the credibility of that content if it's somebody, if it's an organization that's global, that's an organization that's national. If you could provide any resource, staff, tools, money to help with your project, what would it be? So for the activities that we've done so far, at least from my end, I haven't needed a budget, but the University Health Services, they have a budget, and they've been more than willing to utilize their budget for our activities. So I would say if you're going to partner up, maybe try to partner up with somebody who has a little bit more money than you do and has more people. So when we hosted, for instance, the first time, the workshop in the gallery of the library. So it was just me, and I had my tech support to help with any technology issue. But when the health promotion director came, she came and she brought 4 boxes of like various handouts, and she brought 3 students, and she brought goodies. And I was just like, oh yes, that's what it's like to have lots of staff and money. Let's see, another question. There's a good tutorial on Medline Plus about evaluating health information. Yes, there is, and I utilize that. So I didn't talk during the during this webinar about the actual content of the workshop. So I sort of mentioned briefly the workshop, both the 15-minute and the 30-minute workshop. They both start with a scenario, actually several scenarios. We have the students group up into, depending upon how many students or how many people attend the workshop. So let's say maybe there's 20 students, so we group them up into pairs. Each group is given a health scenario, a common UMBC health scenario that our students attend the UH services for. And they're told, well, here's a health scenario, like read it, and then go online to see if you can diagnose that particular student. And then they go around and they tell the whole group what they think that particular health scenario is. And they're like, oh, we think this person has the flu, or we think this person has some sort of STI, et cetera. And then I take over and I do a session on sort of health literacy, and we go over Medline, and we will also go over WebMD, because that tends to be a favorite of the students that we work with. And then we end the session going back to the health scenarios and actually identifying what the real health element of each of those scenarios were. That tended to get a lot of feedback, a lot of good interaction. And we like I said, we utilize Medline Plus. I don't show them that tutorial, but I've used that Medline Plus tutorial myself. So we have maybe a time for one more question. So let me see through the chat box. Let's see what resources. Oh, so thank you for the person who put the information about the matrix. That's really, I specialize in research and impact and collaborating with other health sciences librarians. Oh, that's wonderful. I mean, I actually would love to talk to you after this. Okay, what else everybody has? Any partnerships? Do you have any partnerships with academic libraries and so no, but when I was doing my original research, I mentioned this person's name, Liz Waltman. She works in NLM, and I contacted her. She was one of the early people that I was brainstorming with and trying to sort of telling her, like, I'm finding not a lot of content on this particular population. One of like my eventual goals, once this sort of project becomes a little bit more solidified, is to see if there's partnership available with other organizations. UMBC is a state school. We have a lot of collaboration with the other state schools in Maryland. So if there's opportunity, I'll just say that. And I think that's it. Gerard, are you there? Okay, so thank you for listening to me for the last hour. If anybody has any questions or wants to get a hold of me after the session, my contact information is all the way at the, I think, top of the slideshow. You're free to contact me, and yeah, thanks. It's been enjoyable.
All right, thank you so much, Samhar, for that great presentation, and thank you to you all for attending and your participation. I'll just go through a couple more housekeeping details very quickly here. Let's see, we will have the recording for this webinar posted on our YouTube channel. That will happen within the next week or two, and I will put that link in the chat box for your convenience. And in addition to that, you can fill out an evaluation for this class, and when you do that, you will see a checkbox saying, yes, I also want MLACE credit for this, and that will show you information about how to claim that credit, including the enrollment code for this class. So that's the link that you see on the screen here, and I will also drop that in the chat box. All right, so again, thank you, and a huge thank you to Samhar for sharing your time and your insight. And so we will call it a close here. Have a great afternoon, everyone.